welcome to Along the Rock, our podcast. And our guest today, very thankfully, is Courtney Teller, who gives a lot of vaccines, and she did that even more when she was at KSB Hospital. Courtney, thanks for coming.
Thank you.
And I appreciate your experience because I have a feeling that there are a lot of people my age and older who get a little bit confused when you tell them how many vaccines they can have and when they should get them and which variant and all of that. I just think it can be a little overwhelming sometimes.
Yes.
And I guess we'll talk about one or two that aren't really vaccines. They're just something you can get preventatively. Tell us a little bit about your background first. You've been doing this at the health department for a few years, but before that?
Sure. I graduated from PA school, Rosalind Franklin, and I started my first job at KSB. That would have been just over 12 years ago. I worked there for just under 10 years, and then I moved over to the health department. It'll be 3 years in December.
Okay. And this, I don't think I mentioned it, this is the Lee County Health Department.
Yes, so. Lee County Health Department in Dixon. I did quite a few different things at KSB before I came to Lee County. I worked in OBGYN for a few years, and I did some family medicine with some wound care, actually, and some employee health services and urgent care as well. So kind of a diverse role. I've kind of seen a lot of different things.
Well, that's, you can decide that way which you like best, and if you can find somebody that's willing to fill that need for you, I guess it works out pretty well. COVID, of course, is on everybody's minds these days, except I think there are a lot of people out there, and maybe even a lot of people older like myself, who think, COVID's all gone. That's not true, is it?
No, not at all. We're still seeing very high numbers of COVID. I think that it probably, from my opinion, those concepts come from the fact that people aren't necessarily dying of COVID anymore. Not that they can't, but it's just not like it was originally. Is much of a scare. People are getting sick. It's definitely still around. In fact, at the health department, we give out COVID tests for free, and they're going wild right now.
Yeah.
They are stocking them multiple times per day.
So people are becoming more aware of what's really going on.
Sure.
And not just falling back on the easy answer would be, no, that was a couple of years ago. We don't have to worry about that anymore. More and more people with long COVID now, I've been hearing on the news and reading, doing a little research. But another one that's also very common, and you can get, I guess, at the same time, because I know my wife and I have, is the flu vaccine.
Yes. So influenza season is very quick approaching. It seemed like for a year or so there, we kind of had a low flu season when COVID first hit, but it's definitely back to being a thing that's pretty common around here. And flu time is coming up usually late September into October. So flu vaccinations yearly, every year is the recommendation still.
Mm-hmm. Also can be very dangerous.
Influenza.
A lot of people think the flu. I had that when I was little, and no big deal.
I think it's a pretty big misconception with flu too, because a lot of people think flu and they think the stomach flu, the vomiting and things like that. A lot of people don't realize that influenza is generally the respiratory flu. It causes the high fevers, the chest congestion, and all of that. And it's still deadly. I mean, there are many people who pass from influenza every year still.
Does that stem, or does that cause, I should say, the condition they know as the walking, not the walking flu, but the walking pneumonia?
Walking pneumonia, I'm not sure that it's directly related. I think they can often be caused by different pathogens. Mm-hmm. So, walking pneumonia is usually a bacterial thing. But influenza, a lot of times people have problems when they get secondary infections. So certainly that may be something. But they can get pneumonia. Influenza causes pneumonia frequently, viral or secondarily bacterial as well. But that can be one of the major complications and risks of influenza for sure.
Okay. RSV, I honestly don't know what it stands for.
Respiratory syncytial virus. I feel we used to think about a lot in babies. RSV was very common in my experience at KSB. I worked kitty corner from a pediatrician's office, so we would see the premature babies coming in for the old treatments for RSV to prevent infection when they were born premature. Now, just recently, within the past year or two, we started giving out the immunization for RSV, both for the babies and for the older adults who are at more risk for severe infection. So RSV virus has always affected adults, but we've realized that it's causing more severe illness in adults, and so we're able to vaccinate some of the older population as well as the babies. So with RSV vaccination now, we are giving that to pregnant women when they are due in those high-risk seasons. So RSV season high risk starts in September, goes through the winter into January. And so if you're pregnant and going to be delivering along those terms, we can give you vaccination in pregnancy. And if we don't vaccinate pregnant moms, we can give it to the babies so that they don't develop severe infection because they're the most vulnerable when they're newborns. Now, recently, we've been approved to give the RSV vaccination to older adults because we've found that they become severely ill just like babies because their immune systems start to be compromised. So the newest guidelines are to consider vaccination in somebody who's 60 to 74 if they have those immunocompromising conditions. And there's a pretty long list of the conditions. You could speak to your provider about if you meet those criteria, things like diabetes or immune suppressing medications, things like that. And then everyone 75 and older is recommended to consider getting that RSV vaccination to prevent severe respiratory illness. Again, it's a respiratory kind of like influenza.
Do a lot of people ask for it, or do you have to educate them?
Well, it's pretty new, and with my role at the health department, I'm not necessarily doing primary care, but we definitely see people coming in and asking us about it. They're starting to, see signs around at the pharmacy and at the doctor's offices about RSV. So we have had quite a few people reaching out and asking the immunization department about those RSV vaccines. The problem is when they're new, there's still a lot to be found out about those. So certainly we have people coming in. The one thing I will mention is health department doesn't generally do a lot with Medicare. So, some of those patients I think are going to the pharmacy a little bit more frequently.
Okay.
But for the WIC side, they definitely are seeing some of those new moms coming in with the babies, especially for the RSV.
Okay. I understand another condition that's talked about a lot during the summer, and we're still there for all intents and purposes due to the weather right now. West Nile virus. Now that's not a vaccine, right?
No, there is no vaccination out there for West Nile virus currently, at least.
So do you know what the treatment is?
They just have some medications that can help treat the symptoms of West Nile virus, but I don't know the specifics exactly what medications they're using. But I do know that at the health department, our employee health department does test the mosquitoes, and I believe they do see some positive West Nile mosquitoes in the area. And unfortunately, like I said, there is no vaccination for that, but it is a valid concern because we occasionally hear of those cases throughout the years.
Yeah, who can tell from a little tiny bite from a mosquito that you're going to get really, really sick?
No, you can't. You don't know.
Okay. Well, again, that's a condition that was talked about during these hot months. Shingles was something I had never heard of in my life until my wife told me that she had had it as a younger woman. And I shingles, what's that? Why do they call it that, and what does it do? Because I had no idea.
Sure.
More common now, or just more commonly known now?
I think more commonly known now. So shingles is a virus that's similar to chickenpox. So if you have immunity in your system to chickenpox, you can develop the shingles virus. And so it creates blisters and sores on the skin wherever the virus affects that nerve pattern. And it can be very painful and uncomfortable, but it's been around for a long time. Vaccination's been around quite some time, but they're always changing. They've several years ago got a little bit better of a vaccination, and it's now routinely recommended for adults 50 and older. But if we have those immunocompromising conditions, there are certain populations, 19 and older, that can even get the vaccination. But everyone who's a little bit older is recommended to get the shingles vaccine.
And I guess, I learned from you earlier today that shingles can be, other than being very painful and upsetting your life, it can also infect you in different areas of your body.
Yeah, shingles affects nerve dermatomes, which just basically is where that nerve innervates the body and gives you the sensations and things like that. And where the shingles affects the body can be different in everyone. So very common to see it on the trunk, midline somewhere on the back or on the chest. We'll see it around the armpit area often, but it quite frequently affects the face and head. You can affect the ear area or the eye area, and sometimes when those viruses affect that area, it can cause some damage to your sight or your hearing, which can be a really poor complication.
Yeah, as I say, quite dangerous in some areas, especially you mentioned the eye and the ear as well.
Sure.
And that's something that, and I guess that will last. Does everything that shingles provides, if you will, last if you haven't gotten the shingles vaccine?
No, not always. Oftentimes it's self-limiting, means it will go away on its own within a couple of weeks. We can give you antiviral medications to speed up the rate of cure. But some unlucky patients will have long-term damage to those nerves that creates a similar pain or discomfort or sensation that can be long-term and very bothersome. So those people are pretty unlucky in that aspect.
Any that I've forgotten along the vaccine front?
Sure. So, we'll kind of just go over broadly. So,
Sure.
we're kind of talking about adults, so pneumococcal vaccinations. There's been some changes to pneumonia vaccinations. We vaccinate children with the pneumococcal vaccine. Routinely, 65 years old and older, we will get a pneumococcal vaccine. Once there are different vaccinations, so it can be kind of confusing, but just to kind of keep it more basic, pretty much everyone over 65 should have a booster for their pneumococcal vaccination. If you have some of those conditions, maybe asthma, diabetes, you may want to consider getting a vaccination or maybe multiple vaccinations, depending age 19 and above.
Sure.
And those pneumococcal vaccinations again for pneumonia and lung problems for pneumonia strains.
Is there a difference between pneumococcal pneumonia and regular old?
It's just the type of infection it is. So the bacteria that cause different things, because viruses cause bacteria. Viruses can cause pneumonia. Bacteria can cause pneumonia. So there are different strains of different things that can cause these different infections. Outside of the pneumococcal vaccine, adults should still continue to get tetanus vaccines. We get a tetanus vaccine in 6th grade, is usually in Illinois where we get our tetanus shot. And then it should really be done every 10 years. It's also important, a lot of times, we're having grandchildren, children. We vaccinate pregnant patients, regardless of how long ago their last tetanus shot was, in each pregnancy, to prevent specifically pertussis in children before they're vaccinated. So we're used to calling the tetanus shot.
Right.
But most tetanus shots actually have tetanus, diphtheria, and acellular pertussis. So it's a combination, not only just the tetanus shot for most of the time. So every 10 years that should be updated. And then, like I said, if you have a little bit older adults, it'll also protect if you have your grandchildren or anything like that, if you're around other children. And it's a pretty good vaccination to keep updated. On top of that, we also have HPV vaccination.
Another one I've heard of, but forgot to mention.
We routinely recommend that starting in usually 6th grade vaccinations. It can be given as early as 9. And we can give that all the way through age 45 now. They've updated guidelines recently over the past few years. They found that the vaccination works so well, it's actually a cancer-preventing vaccination, which is one of the only types of cancer-preventing vaccinations we have. And so it's now approved through age 45. So that's another adult vaccination that we can do.
Okay.
think those are most of the adult
Yeah.
vaccinations.
Now, I guess the question that I think a lot of people have with all of those possibilities is, how many can you take at once?
You can definitely do multiple vaccinations at once. Certainly some people have their opinions. Most vaccinations can be given together. There are timelines and schedules for all the vaccinations, but especially COVID and flu, they're definitely okay to give together. You can get them in the same season. I wonder if they'll ever have a combination vaccine for that. They may. But it's okay generally to give most vaccinations at the same time. Certainly want to talk to your provider, specifically if you have certain ones that want to be given together.
I don't want to come back unless I have to, so
Yes.
give me them all.
Yes.
What do you tell the doubters? There seems to be a growing number of the population that says, I'm not doing this. The chances may be small, but I don't want my child to have any chance of, suffering damage from this. What do you tell them?
Well, we have to respect our patients, obviously, and their
Sure.
wishes. My job is definitely to just educate, show them some studies, show them the results, show them how frequently, people have adverse reactions, because I understand, even being a provider, sometimes you get nervous yourself, new vaccines when COVID vaccine came out, because they simply haven't been studied well, that long. So I understand that they have doubt, and I respect that, and I just educate them the best that I can. And you're always going to have people that, they just don't feel comfortable with that, and that's okay. We just want to show them the data that's real. I think a lot of times people see, ads on Facebook or things they hear from family and friends that maybe just simply aren't true. So we want to make sure they have real data that is, factual versus just hearsay. Because, we know vaccination works, right? So we've seen, vaccines really save a lot of lives, and that's what's really important.
A history book would be appropriate, I think, in some cases when you think back to, the flu of 1917 and how many people died just from the flu. And I say just from because, as you say, people think of it as not much.
Sure.
Diphtheria.
Yeah.
That had to be part of one of the first vaccines.
Yeah.
And that was definitely a dangerous condition, and a strange one as well. You get things growing in your throat, cutting off your wind and everything else.
Yes.
And more recently, it just went out of my mind now. There are some other conditions that have, I guess, come up in the news is the best way to say it lately. Measles has popped up in some places, and most people would have thought it's gone. You don't have to worry anymore. Not gone, is it?
No, not gone. Not gone completely. As we see more and more of those people who are vaccine hesitant, those herd immunity levels become under a threshold, and we start seeing these cases. A majority of them are going to be in unvaccinated individuals. But a lot of people rely on that herd immunity, meaning that if a certain percent of the population is immunized, then it should eradicate that infection. But once those numbers start dropping, we'll start seeing these infections becoming a problem again. I know that that's happened in Chicago recently with measles, and some other places as well.
I know what I was trying to think of, and it wasn't recently, as I thought it might be. Polio, for gosh sake. I mean,
Yes.
That's Dr. Salk is probably one of the best known doctors ever.
Yes. I did hear, I think that was a year or two ago maybe, that I heard last about polio. But again, childhood immunizations, we're immunizing everyone that wants to be vaccinated against polio, in those early childhood immunizations. So, early childhood, the immunizations start even at, birth, basically, hepatitis B vaccination, and 2 months, 4 months, 6 months, 12 months, sometimes 18 months if they break up the vaccination, and then you're usually good for a few years until those preschool, kindergarten, 4 to 6 year vaccinations. So they start to space out a little bit, but I know that poking a newborn baby with multiple vaccinations every couple of months becomes
Not popular with the parent.
Yes, becomes a little stressful at times, but yeah, it's very important because we have eradicated some of these pretty severe infections. And, as you said about the vaccine hesitancy, some people are just like, well, chicken pox is probably not gonna, kill me. I can let my kids get chicken pox, they'll be okay. But, it doesn't always work out that way.
Yeah. All right. Well, I've been talking with Courtney Teller from the Lee County Health Department. Courtney, thanks for coming up to our second floor studio here.
Thank you.
And it was very educational.
Yes.
That about does it for this edition of Along the Rock. I'm Mark Morris, and hope you can join us next time